Okay, well, good afternoon and welcome. I'm Simon Cohn, the newly elected chair of the eHealth, the National eHealth Collaborative Board of Directors. I'd like to call this session of our meeting to order and thank you very much for joining us. For those of you able to join us here in person, printed copies of the agenda and presentations are available, I believe, just outside the door. Okay. For those of you online, the packets can be downloaded from the NEHIC website, which is www.nationalehealth.org, and is available now. As always, we welcome your questions and comments via the webinar, or you can email to info@nationalehealth.org. Or our staff is also monitoring Twitter, #NEHIC, and the NEHIC Facebook page. Before we introduce our presenters for today, I would like to introduce everyone, first of all, to our newly elected board members. And we're delighted that they are on board. Most of them are actually with us today. The first is Holt Anderson. Holt is the executive director for Enchica, with a private nonprofit consortium with the mission of improving health and healthcare in North Carolina. He is current member and vice chair of the NHIN Coordinating Committee. Next is David Baker, a physician and professor of medicine at Northwestern Medical School. His research has focused on health literacy, racial and ethnic disparities in care, and quality of care for chronic disease. His current research examines the use of health information technology for communication, quality measurement, and improvement. He's been a member of groups such as the Physicians Consortium on Performance Improvement and the American College of Physicians Performance Measurement Committee. Next we have Alice Brown, who's actually one of our panelists today. Alice is Director of HIT Policy at the National Partnership for Women and Families. There she leads their efforts to shape public policies related to health IT in a patient-centered way. She's an attorney, and we're obviously delighted that she can join us on this panel today. Also new to the board this year is Patricia Metaggart. Patricia is an associate professor in the Department of Health Policy and Management at the University of North Carolina, as well as a lead research scientist at the George Washington University, where she instructs graduate students in health information technology policy as well as state health policy. Our final new board member for 2011 is Charles Parker. He is Executive Director of Continua Health Alliance. He has over 20 years of experience in health technology, policy, and the strategic design of evaluation and measurement approaches. Now, I would also like to just take a minute and introduce Kate Berry, our new NEHIC Chief Executive Officer. Kate brings over 20 years of healthcare experience and senior management experience to NEHIC. She has a successful track record in corporate and nonprofit organizations. We are delighted to have her joining us to help further the vision and mission of NEHIC. Kate, do you have any comments?
I would just like to say thank you. I'm very excited to be here and welcome to our panelists. I very much am looking forward to the discussion on consumer engagement and the consumer connection this afternoon. Thank you.
Okay, thank you. Well, I think we've got a great stakeholder forum today, so let's get started. As the health information technology landscape rapidly changes and expands, opportunities for consumers to engage more effectively in managing their care is increasing. Today we will be exploring how developments in health IT have and will impact and promote consumer engagement in health and healthcare. So let me introduce our presenters. First, I'm pleased to present Will Yu, who is Special Assistant for Innovations and Research with the Office of the National Coordinator for Health Information Technology. He will provide a summary of the recent ONC-sponsored meetings on personal health records. Next, as I mentioned, our new board member, Alice Brown, Director of Health Information Technology Policy from the National Partnership for Women and Families, who will offer a perspective on the information-rich healthcare system of the future. Finally, Dr. Tom DeBacco from Beth Israel Deaconess Medical Center in Boston, who will discuss Open Notes, a project to measure patient interaction with electronic medical records in terms of error detection, a project which was recently awarded a Robert Wood Johnson Foundation grant. Now, before I turn it over to Will, I just wanted to ask Mary Jo to introduce one other person on the call.
Yes, this is Mary Jo Deering, and I wanted to take this opportunity to introduce someone who, those of you who had been watching the NEHIC website would have seen her name as a presenter, but the reason she's not presenting today is that her first day today is with the Office of the National Coordinator for Health IT. So I believe we have Lygia Ricciardi on the phone, and while she's not going to actually be on the panel and making a presentation, I thought it would be wonderful if she could just say a few words and introduce herself to both the board members here and those who are interested in the subject on the call. Lygia, are you there?
I am indeed. Can you hear me?
Barely.
Okay, I will speak louder. Thanks so much, Mary Jo, and thanks to NEHIC for inviting me to join you today at the Stakeholder Forum. There are clearly a lot of exciting changes going on with your staff and your board. I was very much looking forward to presenting today, but as Mary Jo mentioned, unbeknownst to me when I first planned to participate with Aaron, I am starting a new position at ONC, and specifically, it is a job that will allow me to work and to focus explicitly on strengthening the consumer voice and the consumer perspective relative to eHealth policy. So on the unfortunate side, logistically, today didn't work out for my presentation, but in the bigger picture, I think this is going to be an exciting opportunity. I know that Alice Brown from the National Partnership for Women and Families will do an excellent job on what was to have been our joint presentation. And I think in the big picture, I'm really excited because there's a lot of evidence that I see that there's growing support for greater consumer engagement in this field generally. And you'll see some of that in Alice's presentation, to which numerous consumer groups contributed to help to define a vision and a path forward in the eHealth or health IT arena. In addition, I'm really excited that ONC decided to create a position like the one that I'm starting today, and I really look forward to working with colleagues both within ONC and outside at NEHIC and elsewhere to help strengthen the consumer agenda. Lastly, it's terrific that NEHIC has chosen this topic for your stakeholder forum, and I also see that you're making other commitments in choices, for instance, some of your board members today to kind of bring consumers into the dialogue more. So again, thank you so much for inviting me to join you, and I hope that we can catch up at another time, perhaps a future forum or other opportunities.
Well, Lygia, thank you very much for meeting with us today, especially on your first day of an important new job. So we look forward to obviously meeting you in person and continuing the dialogue.
Excellent. Thanks.
Okay, thank you. Now, as I turn this over to Will, I just want to comment that we will be holding questions until after all of the presenters have had a chance to discuss their materials. Afterwards, we will moderate questions first from the board, then from people in the audience, and finally, we're obviously going to be taking questions online. With that, Will, thank you very much for joining us.
Thank you, Simon. Just wanted to clarify, are we sure that I'm proceeding next on the list? I was told that I might be second.
Alice, going first. You know, Will, thank you very much. I think it's Alice. Given what's going on up there, it looks like Alice, you're going to be going first. Sorry about that.
You should feel free to go right ahead and present this. Thank you so much for the introduction. Again, I'm Alice Brown from the National Partnership for Women and Families, and this is my first NEHIC board meeting, and I'm really thrilled and honored to be here. So thank you so much for having me, both as part of your organization and as a consumer representative. The presentation that I'm going to give, as Lygia said, is really an articulation of a vision that we've developed at the partnership in conjunction with our coalition, the Consumer Partnership for eHealth, which I'll talk a little bit more about. And the narration and development of this platform was Lygia was instrumental in it. We couldn't have done it without her, so she's sort of here in spirit and on the phone. This is a little bit awkward since I'm going to have to turn sideways and read my notes as I do this, so hopefully you can still hear me. The presentation will really be in 4 sections: background about our organization and coalition, the principles for this consumer vision, the role that consumers can play, and if we're successful, which I believe we will be, the potential impacts that we will have. So just a little bit about the National Partnership for Women and Families. It's a nonprofit organization with nearly 40 years of experience working on issues that are important not only just to women but to families as well. And though we work primarily on the national level, we are increasingly having a grassroots presence in a number of states. And our priority areas are to improve access to quality, affordable health care, promote fairness in the workplace, and advance policies that help women and men meet the dual needs of work and family. The partnership leads a couple of coalitions, including the Consumer Partnership for eHealth and the Campaign for Better Care. And I just wanted to note that our Vice President, Christine Bechtel, sits on the National Health IT Policy Committee in addition to what seems like every single one of, but probably is just a handful of the work groups, including the Meaningful Use work group. A little bit about the Consumer Partnership for eHealth. This is a diverse coalition of nearly 50 consumer, patient, and labor organizations whose members have been active in the health IT policy world for over 5 years, and in many cases longer. The coalition advocates the implementation of health IT that supports consumer engagement in health and health care. And really, this group was instrumental in the passage of HITECH in that we mobilized the coalition members and then in turn all of their individual members to really help the Secretary Sebelius stand strong on meaningful use in the face of significant pressure from opposition. This vision that I'm going to be talking about was developed with the coalition over the course of the last 5 years of involvement in health IT policy development. And it represents consumer expectations of reformed healthcare system that is supported by better information. And underlying all of this is the idea of consumers really as an untapped resource in helping this occur. Not only that consumers are the targets of improved healthcare, but really can be participants. We want to be partners in making this system work better for everyone rather than just the sort of beneficiaries of an improved healthcare system. Underlying this, of course, is the obvious notion that technology has transformed other industries and that consumers use technology in almost every other area of their lives. And at the same time, consumers routinely experience great frustration with the current healthcare system in terms of poor communication, lack of care coordination, and sort of untenable burdens of care. Consumers, however, really do understand that technology can improve their care experiences, the quality of the care they receive, and they even understand how. Recent research from the partnership has shown that the idea of health information technology and the specific aspects and benefits of it resonate clearly and immediately with consumers. A lot of times we hear that consumers don't understand health IT, that it's too technical, that it's too complicated, and it's very important that we change that perception because it's simply not true. Fortunately, the trends do show that technology is being used increasingly for healthcare purposes. We know that from internet search statistics, from the number of applications for smartphones, and the extent to which social networking sites and social communities are being set up in ways to improve healthcare by communicating, by increasingly communicating and using technology to bring that about. And that's wonderful, but we need to make sure that we find a way to leverage these behaviors within the healthcare system so that it's not just occurring outside of it and among consumer groups, but that it's becoming part of the way that we deliver care.